Welcome to Hello City. Today I'm bringing you yet another talent here in Mediclinic, one of the top oncologists, Dr. Saeed. Welcome, Doctor.
Thank you, Dr. Saja. That is very, very kind of you. It is a pleasure to be here today.
Of course, thanks for coming. Can you provide us with an overview? What are the advancements in cancer therapy?
We have been very lucky in the past 10 years that we have seen a lot of advancement in treatment of cancer from the world of genomics, which has basically been able to decipher the genomic abnormalities cancer, to the advancement of immunotherapy, which has brought a lot of excitement to the world of oncology and treatment of the patients. We will be seeing a lot of more excitement in the world of oncology with the advancement in AI, for instance, in the screening of cancer, in using other modalities to treat the cancer more effectively and also to diagnose the cancer more quicker as well and the earlier stage.
And talking about that, can you elaborate a little bit on the importance of diagnosing and screening cancer earlier on?
Of course, the sooner that you are able to diagnose the cancer at the earliest stage, obviously, the more likely you are that you can cure the patients.
Sure.
And at the end of the day, all of us, we aim to, cure the patient as much as we can. So it is extremely important that patients, they are aware, or the general public are aware of the signs and symptoms of cancer in order to do the earliest screening and to diagnose the patients at the earliest stages.
Of course. Now, cancer has a lot of psychological and emotional challenges. I, for once, have family members that were diagnosed with cancer. Can you tell us, how do you deal with that in your practice?
Cancer, on its own, it's a very complex disease. And, treatment of cancer, it involves a lot of specialties, multimodality treatment, from the surgery to chemotherapy to radiotherapy, very long follow-ups. And unfortunately, the treatment of cancer is such a long treatment and also requires a long follow-up as well. Naturally, after going through a lot of visits with different specialities and such a long treatment, there will be some emotional and psychological impacts, not only on the patient but also on their families as well. And I think it does certainly impacts how to deal with the cancer, and we do have to address these up front. And one part of our jobs as healthcare providers and oncologists is just to make sure that we are with our patients at every single stage of their treatment. If they have any psychological issues, we need to address it up front. We are very lucky indeed that at Mediclinic we have a clinical psychologist who can see the patients and address any psychological needs that they have.
More of a comprehensive approach,
Indeed.
Of course, yeah. So now immunotherapy have gained a lot of publicity and a lot of buzz, if you will, and it has a lot of potentials, but it also has some limitation. Can you elaborate on that?
Yes, we have been so very lucky that we live in a generation that we have seen such an excitement in the world of discovery of how our immune system works and how it recognizes the cancer and how we can actually get our immune system to start fighting with the cancer as well. We have seen a lot of advancements with addition of chemotherapy to the chemotherapy, to addition of immunotherapy to chemotherapy, or using immunotherapy on its own to fight with the cancer. As an example, for instance, it's only very few years ago that we had a great deal of difficulties in treatment of melanoma or non-small cell lung cancer.
Yeah.
Even now in breast cancer, we use immunotherapies. We have had such a big excitement in a certain group of patients with colorectal cancer that they have complete response to immunotherapy. So immunotherapy has brought a lot of excitement, a lot of advances in treatment of patients with cancer, and I think it will continue to do so in the next couple of years as well.
Excellent. And the other thing is happening right now, also precision oncology, right? Can you tell us how is that used with those specific genetic mutation?
So one of the advancements that we've seen in the 20th century, 21st, is that how to actually sequence the genome in the cancer and to decipher what are the signaling pathways that signal the growth of the cancer. This has been a major step up in treatment of the cancer, because nowadays we can actually take a piece of the tissue out of the cancer, extract the DNA of the cancerous tissue, and then sequence it to find out what are the major mutation or genetic changes that signal the growth of the cancer. So that is a huge advancement. And now on the back of this, we have been able to make some drugs that they actually switch off those mutations.
Wow.
And in order to stop the growth signal of the cancer. It's just like, having an electricity light and having a switch. So once the electricity switch is on, then your cancer is growing. So we are able now to identify the drugs that they target the switch and switch them off. Therefore, the growth of the cancer is stopped.
Sure. Now, things like acupuncture, mindfulness, a whole holistic sort of approach to cancer. What are your thoughts on that?
So again, like what we discussed, treatment of cancer is very complex, multimodality and, a long treatment. And certainly this might have an impact. And, constantly you really need to make sure that your patient's psychological needs are addressed properly. So, if you are able to use other things to enthuse your patient, keep them positive, keep them focused on the treatment, obviously, this is something that we encourage. For some of the treatments, such as acupuncture, I'm not really sure whether we have any psychology, the scientific proof here. Certainly, there are some suggestions, but again, as you know, in the world of medicine, we work based on evidence, and I think unless we have a solid evidence, we cannot completely kind of recommend that.
Sure. In the era of now the telemedicine, how has telemedicine helped cancer treatment? And what are the benefits? What are the drawbacks, if you will?
I mean, to be honest, it has hugely helped us to communicate with our patient more effectively, especially in a country like UAE, that we have a lot of international patients. They are coming and going, and they have jobs and moving between different countries. It helps us a lot to keep contact with our patients. I have patients from Canada, France, Cameroon, Pakistan, Turkey, all around the world, and not only through Zoom or telemedicine, but also communication with better technologies, WhatsApp and the rest of it. It can help us hugely to keep the contact with our patients and to help them if they need so.
Thank you, Dr. Saeed, for joining us today. Your answers will help a lot of people, a lot of patients, and a lot of their families as well.
Thank you very much indeed, Dr. Saja. It's been a great pleasure. Obviously, we are very fortunate that at Mediclinic we have such a comprehensive group that we can help our patients. And I'm really grateful for the opportunity so that we can talk with people and then, especially again, encourage them to do the early screening. And the sooner that we can detect the cancer, the better care we can provide for our patients. Thank you.
Thank you again. Stay tuned to the next episode.